One unnecessary door opening in the theater can increase contamination risk. Sterility is invincible until it fails. And when it fails, patients suffer. Welcome to my corner, a space where compassion meets purpose. I share real life experiences, health insights, and the untold stories of life in scrubs. This space is dedicated to healthcare, insights, professional growth, and the true essence of nursing. I am Nurse Mamli O, a true storyteller, advocate for compassion in care. I also share evidence-based knowledge, patient care advice, real nursing moments, health tips, and lessons learned from life in the wards and on theaters. Here we learn, grow, and inspire one another to serve with empathy, integrity, and excellence. Follow for nursing inspiration, patient care tips, and realities of profession that shape us every day. You can also join me as we celebrate the highs, the lows, and uplift each other in this beautiful and sometimes chaotic journey called nursing. Through education and empathy, we can build a generation of nurses and caregivers who heal with both skill and soul. Remember, in this profession, you can earn your blessings or earn your curses. The decision is yours. Welcome back to Nurse Mamli O. This is episode 4. Remember, we are on Theatre Safety Series, episode 1 to 5. This is episode 4 of my Theatre Safety Series, where we break down what really protects patients inside theatre and in the operating room. Our main topic today is infection control in the theatre and why sterility is not just a rule, but a discipline. Because surgical site infections are preventable, but only if systems are respected. Why does infection control matter? A surgical site infection can actually lead to the following: prolonged hospital stay, reoperation, the patient going back to theatre, sepsis, which means the patient gets infected, really bad infection, delay in healing of the surgical wound and surgery, increased healthcare costs, and in severe cases, there may be death. And here's the key point. Many infections are preventable. That prevention starts long before the first incision in the operating room. The second is the surgical hand scrub. Before entering a sterile field, we perform a surgical hand scrub, not a quick hand wash. And 3 is a timed methodical scrub, usually 3 to 5 minutes. We wet hands, then fingertips, then in between our fingers, around the thumbs and up to the elbow. In theatre, we don't scrub out of habit. We scrub with intention. The third is gowning and gloving. Once scrubbed, we dry our hands using a sterile technique. We don a sterile gown and we put on sterile gloves. Only the front of the gown, from the chest to the waist, is considered sterile. Anything behind us is non-sterile. Anything below the waist is unsterile. Boundaries are clear, very clear, and those boundaries must be respected. The fourth is sterile field. The sterile field includes the draped field, the surgical area, where the instrument trolley is and the scrub nurse's working zone. Nothing unsterile crosses that field. If sterility is broken, we acknowledge it, we correct it, We do not ignore it. One break in technique can introduce bacteria. The fifth is airflow. Airflow and door discipline. Modern theaters often use laminar airflow systems. These systems reduce airborne contamination, but here's why many people underestimate this. Every time the theater door opens, airflow is disrupted. More people entering equals to more microorganisms. Theater must be controlled and traffic must be controlled. Door discipline is infection control. The sixth is antibiotic prophylaxis. Antibiotics are given before incision and timing is very crucial. Too early, the levels drop. Too late, protection is reduced. This is part of WHO, which is World Health Organization checklist for a reason. 7, we have infection control is not glamorous. This is because it is repetitive. It is disciplined. It is sometimes inconvenient. But sterility is invisible protection. When it fails, patients feel it. That is why theater nurses guard the sterile field fiercely. In theater, sterility is not about perfection. It's about vigilance. It's about systems that protect patients when they cannot protect themselves. Infection prevention is not optional. It is structured discipline under pressure. If you found this helpful, please like, share, and subscribe to Nurse Mamli O. If you are a theater nurse or a student nurse, please share your experiences on the comment section below. The next in this series will be discussing cardiac arrest in theater, and I will call it Code Blue, because in theater, safety is never accidental. It is intentional. See you in the next episode, and remember this channel is for information purposes only. Thanks for watching.